Welcome to the presentation on improving care transitions from the emergency department to the primary care provider. There is an increased use of the emergency room for chronic disease management because primary care appointments are limited. If a patient can't see their primary care provider, they go to the emergency room. Patients discharged to home need follow-up, but appointments are a month away, so they go back to the emergency room if they're not improving. How can we fix this? By increasing the number of available primary care appointments with telemedicine. Video visits are billable and can be done by primary care providers credentialed at the facility. Video software can be integrated into the electronic health record, and visits can be conducted just like they would be in person. The application is easy for patients to use with a smartphone, tablet, or computer. Transitioning care to the primary care provider lowers the cost. ER visits are expensive and not ideal for management of chronic conditions. Chronic diseases should not be emergencies. Telemedicine allows for an increase in contact between a patient and their primary care provider at a lower cost. An increase in contact between the patient and the primary care provider would improve compliance and build a better relationship. Video allows for face-to-face with the patient while looking at their chart and the opportunity to share results on screen to improve patient education. Most visits are about 16 minutes of discussion with a primary care provider, but there are so many other factors that cost time and money for patients to get to their appointments. Telemedicine allows the patient and the provider to get right to the discussion and then get on with their days. There's an opportunity to gain feedback at the end of a video call. There's no website for a patient to visit, no code to enter, no comment card or form to fill out and drop off or mail in. The patient can just tap and submit. You can conduct a conference call with family, caregivers, or specialists in real time. This way, nothing gets lost in translation and the patient feels more connected to a team and doesn't have to keep repeating themselves each time they encounter someone new. Primary care providers and staff are already available. Some clinics experience a 50% no-show rate, and a telemedicine visit would be a way to add on appointments to fill those time slots. The primary care provider doesn't have to move from room to room, and all they need is a desktop video camera with a mic, software integration or mobile app, and the patient with a smartphone. We are already using technology for almost everything. Why not use it to improve patient care? In conclusion, we need to bring emergency room patients back to the primary care setting. In order to do that, we need to change the primary care setting to increase capacity. This will help reduce non-emergent emergency room use, improve care coordination between the emergency room and primary care providers, improve chronic disease management and outcomes, which leads to quality care, patient satisfaction, and provider satisfaction. Thank you.